all the components that are needed for the specific surgery, and these components can then be sent along with the surgical template from Nobel Biocare. Each one of these components are specific to the guided implant surgery set, as they all allow for the additional 10 millimeters incorporated into the surgical guide. Therefore, when drilling for a 15 millimeter implant with a guided twist drill, we are actually using a twist drill that has the 25 millimeter mark concurrent with an actual 15 millimeters. At this point, the anchor pins have been removed, and you can see that there is some bleeding, not through the osteotomy sites, but rather through the areas where the anchor pins were put in place through the mucosal tissue. And this is fairly typical of what we see at the removal of these anchor pins. Any additional soft tissue around our implants is now removed, in this case with a rongeur, and now we are ready to proceed with the placement of the fixed restoration. Following removal of all the soft tissues that would interfere with the placement of the prostheses now can be placed. This is a Procera implant bridge whose framework was designed by Murata Dental Studios, fabricated by Nobel Biocare, and then Murata Dental Studios completed the restoration. This prosthesis is secured to the fixtures with guided abutments specifically designed for the Nobel Guide Teeth in an Hour prostheses. These guided abutments allow for the slight error inherent in any guided surgery and guided implant placement. The abutments allow for 1/10 of millimeter discrepancies in a vertical axis to be compensated for. After placing each of the guided abutments into the prostheses can then be seated on the fixtures and torqued into place. Prosthesis is now placed in the patient's mouth and seated on the fixtures, and then a Unigrip hand driver is used to hand tighten the screws into place.